Excellencies, distinguished delegates, esteemed colleagues, it's both a privilege and a responsibility to speak to you today on behalf of the Virchow Foundation and to express our profound commitment to the global fight against sepsis. The numbers bear repeating because they are staggering. More than 10 million deaths annually, 1 every 2 seconds. Over 40% are children under 5. And yet, despite these catastrophic figures, sepsis remains one of the most under-recognized and politically neglected global health challenge. This is where the launch of the 2030 Global Agenda for Sepsis, developed by the Global Sepsis Alliance and over 70 expert organizations, is such a watershed moment. For the first time, we have a structured, science-based, and multi-sectoral roadmap to reduce sepsis deaths and disability. This agenda outlines measurable targets and policy recommendations for countries at all levels of development. Yet to date, only 15 countries have adopted national sepsis action plans. Even in countries with supposedly strong health systems, like Germany, an estimated 250,000 to 500,000 cases occur annually, according to different sources. Of these, still too many die, and many survivors are left with long-term disabilities. This makes one thing very clear. If we are serious about achieving universal health coverage and pandemic preparedness, sepsis must be recognized as a defining marker of health system performance. As a co-founder of the Virchow Foundation and the Virchow Prize, I feel compelled to invoke the legacy of Rudolf Virchow. In his spirit, we have to understand that sepsis is both a medical and a social condition. Ending preventable deaths from it will require connecting disciplines, investing in innovation, and listening to frontline workers and survivors alike. We therefore add our voice and full support to the call to establish a high-level political panel on sepsis by World Sepsis Day 2025. I wish you all fruitful discussions, and I thank you for your attention.